friends, and welcome to another episode of Heroes Headquarters. Today's episode highlights two remarkable human beings. Firstly, Dr. Eric Chen, a world-renowned medical oncologist at the Princess Margaret Cancer Center, who treats our advanced colorectal cancer patients. And secondly, Marcelino Dolores, an advanced colorectal cancer patient who thought he had been successfully treated for his stage 4 disease, only to eventually learn that his disease had indeed recurred a few months later in his abdomen. But a referral to Dr. Chen proved to be life-saving because of a clinical trial that was offered to him by Dr. Chen that has joyfully provided Marcelino with a no evidence of disease status. This is a story that inspires hope and encouragement for patients diagnosed with metastatic disease about to embark on their journey. As you watch the video, kindly take note of the hallmarks of courage and perseverance associated with Marcelino and the determination and unwavering commitment displayed by Dr. Chen to help this patient. It is beyond moving, my friends. The story is moderated by Mr. Ryan Clark from Eversana, Canada, who does a wonderful job of bringing to light the bravery of this patient and the remarkable work of this extraordinary clinician. Thanks very much, my friends. Enjoy.
Dr. Eric Chen is a medical oncologist at Princess Margaret Cancer Center and an associate professor within the Faculty of Medicine at the University of Toronto. He specializes in treating gastrointestinal malignancies, mainly colorectal cancer, hepatocellular carcinoma, and gastroesophageal cancers. He is a valued member of CRAN's Medical and Scientific Advisory Board, keeping them abreast of the latest advances in the management of metastatic colorectal cancer. He has also been a longtime supporter of CRAN and a clinical champion for access to clinical trials for their patient population. Marcelino was diagnosed with colorectal cancer with liver metastases in January 2018 and had surgery for bowel obstruction with hepatic resection that same month. After the surgery and 5 cycles of chemotherapy, Marcelino was referred to Dr. Chen, initially meeting in April of 2019. Dr. Chen, if I can start with you, can you tell us a little bit more about your practice and how you support or help your patients through their journey?
Thank you, Ryan. So I'm a medical oncologist specialized in GI cancers. So one of our area of clinical care is participating in the clinical trials. So especially for patients with advanced disease, because we know that right now treatment for advanced colorectal cancer or for all other advanced metastatic disease arising from the GI tract have limited efficacy. So one of our major goals is try to find new treatment options and better treatment options for our patients so that we could help them to lead a more meaningful life and prolong their survival as well.
I see. Okay. Marcelino, let's turn to you. Thank you for joining us. Why don't you tell us a little bit about your story and about your journey?
Okay, thank you, Ryan, for that introduction. Thank you for giving me the opportunity to tell my story, and thank you also to Dr. Chen. So, I was 46 years old when I was diagnosed with advanced colorectal cancer with liver metastasis. I am a nurse by profession, and being a nurse, I can't imagine that I will be diagnosed with this certain kind of disease. Few months before the diagnosis, I remember feeling bloated on and off. Then it progressed to constipation, then finally obstruction. I remember sitting down in ER waiting for my CT scan result that time and receiving a diagnosis of cancer, likely stage 4. It's not what I am expecting to hear. I was never sick in my life than that during the winter of 2018. I would say I'm in good health, physically fit, active. Never did I imagine that I will be diagnosed with CA. January 2018, that's when I had my surgery for bowel obstruction with hepatic resection. So after the surgery, the plan is to have chemo, then another surgery, then finish the rest of chemo. So November 18, I had a CT scan and the result is great. There's no more evidence of intra-abdominal or pelvic metastasis. I'm basically clear. They even did colonoscopy, bone scan, which shows negative result. But January of 2019, I have a routine blood work that was scheduled. And there I saw the CEA is up to 6.6. Normally it's less than 4. But my oncologist said, not to worry. Let's do another CEA test after 3 weeks. And after 3 weeks came, CA is now up to 10.2. So my oncologist was alarmed. So he ordered urgent CT scan. March the 1st, I got the result. And now it's showing peritoneal and retroperitoneal metastasis. Multiple lesions, too many to count, along the lining of my abdominal cavity. So basically, the chemo did not work. I was shocked. I was in total disbelief. Well, I'm still planning to go back to work that time. And I asked my doctor, how can this be? And I asked if surgery is an option. But he said, unfortunately, it's not because there's too many. So obviously, chemo did not work. But he said the good news is there's no organs that are involved, only in the peritoneum. Mm-hmm. So he said, I will make a referral to Princess Margaret Hospital because you could be a candidate for a trial treatment or immunotherapy. So after a while of waiting, I got accepted with the trial. I remember Cynthia, fantastic nurse, very excellent, very dedicated to her job. She said, you are accepted with the trial. And that's the time when I met the wonderful and stellar team of Dr. Eric Chen. So the treatment process was explained to me. My consent was signed. And I was scared, but I'm also hopeful. And I would say from that time, it changed everything. The decision of agreeing for the trial treatment, I think is the best decision I've made in my whole life. I will be receiving the second line of treatment of FOLFIRI every 2 weeks and pembrolizumab every 3 weeks under the direction in care of Dr. Eric Chen. I'm on FOLFIRI and pembro for 2 years. I completed 35 cycles. And my last chemo was April of 2021. And I could tell you, those tumors that were once there, too many to count, can no longer be detected by CT. I said, thank you, Lord. And I owe that everything from Dr. Chen with his team. And because of his medical expertise, extensive experience, his exceptional support and care with his team, I will not be here with you today. Thank you so much, Dr. Chen.
Yeah,
I salute you with that.
We are so happy to see that you did so well. So thank you.
Thank you, Marcelino, for sharing. That's wonderful. Before I go back to Dr. Chen, tell me about your impression of meeting Dr. Chen that first time. What did you think when you first met him?
And Dr. Chen is, I would say, he is an exceptional doctor. He's an excellent doctor because he is a well-experienced and highly respected doctor. He is like a friend. He's like a father figure because I could tell my feelings and my thoughts to him freely. And the important thing is Dr. Chen listens. There are times that I have a lot of questions and I have a lot of worries, but he tries his best to answer my questions patiently and honestly. Dr. Chen as a person with a big heart, he shows genuine empathy. He shows full support to me and my family. With that, our relationship prosper because our relationship is now full of trust. It's full of confidence and respect, Ryan.
If I may cut in,
Sure.
Marcelino, thank you, and I also want to tell a story in that even during his treatment, dealing with all the side effects and everything, that Marcelino is willing to help others. So there's a patient of mine who was similarly young and diagnosed of advanced cancer, and he was so worried about side effects from chemotherapy, and I thought that Marcelino may be a good resources for him, and so I approached him about talking with this other patient, and he, without hesitation, offered to talk with the other patient, tell the other patient what he has gone through, just in terms of side effects or how he was coping, and that was immensely helpful to that patient, in terms of his in his journey through treatment. So thank you for doing that, Marcelino.
My pleasure, Dr. Chen. My pleasure.
Well, yes, and thank you for sharing that. And that's a testament, obviously, Marcelino, to who you are as a person, which leads very, very well into Marcelino. Let me ask you, tell us about your introduction to CRAN.
I met Philomena through Dr. Chen, and I would tell you, I never met a person who is full of life, full of enthusiasm, and very dedicated to her organization. I would say CRAN is excellent and amazing organization because it's an excellent resource for people living with colorectal cancer. CRAN is there to support, they educate, and even advocate for you. So it's an amazing and an excellent organization. And I thank you, I was introduced to CRAN.
And so are we. Dr. Chen, tell us a little bit about the work that you've been involved with through CRAN and Philomena.
So I have known Philomena for a long time, and again, I'm also impressed by her dedication to our patients. And I have had many patients who are members of CRAN and who benefit from the support and the education from CRAN. You know, despite our best effort in the hospital, but you know, we cannot provide all the support patients may need, and so CRAN played a hugely important role in that they spend time talking with the patients, they connect patients, and they connect patients with other resources, so that you know, emotionally patients feel supported.
Very well said. Thank you for that summary and your perspective. So, just in closing, Dr. Chen, I'll start with you. What words of wisdom do you have for patients, perhaps who are embarking upon a similar journey to the one that Marcelino has embarked upon in the context of what we've been talking about today?
I would encourage patients to think about participating in a clinical trial. Talk with your oncologist and healthcare providers about finding a trial that may be suitable for your situation. And finally, I think that you know, not losing hope is important. And you know, we have seen some fantastic results from treatment. So I think that for patients and the family, it is important to also seek out support resources such as CRAN, and so that you have an opportunity to talk with other patients, other caregivers, so that you know, knowing that you are not alone, there is support out there, and so that you could deal with the uncertainty side effects better.
Marcelino, the last word goes to you. I would ask, what piece of advice would you give to patients, perhaps who are just starting on their journey and perhaps maybe focused on having gone through what you've gone through? What words of advice would you give to them on how they can best help themselves as they embark upon this journey?
Yes, Ryan. So don't think that having a diagnosis of cancer is your fault. Cancer is cancer. It can happen to anyone. Cancer can make you feel lonely. It can give you feelings of uncertainty. Don't deal with it by yourself. Don't do it alone. Reach out to others. Speak to people with similar experiences. There are amazing organizations out there like CRAN. They give a lot of support. They provide updates and resources. There are a lot of treatment options. Speak to your doctor. Speak to CRAN, because CRAN is there to help navigate and even advocate for you. It is normal to have doubts, but don't be afraid to at least try. Speak to a CRAN representative. Visit their website, and you will be amazed of what you are to discover. Thank you so much. Thank you, Ryan.
Thank you, Marcelino. Thank you, Dr. Chen. We really appreciate the time you've taken to be with us today.
Thank you, Marcelino. Thank you, Ryan.
Thank you, Dr. Chen. Thank you so much for everything.
Not a problem. It's my pleasure.
Okay.